first for the healthcare industry this week. The nation's health insurers offered to stop basing people's premiums on their health or pre-existing conditions, provided that everyone gets insurance.
I think for purposes of insurance, it's probably a good thing.
I just don't see how they can do it. I don't see how everybody's going to have health insurance. How?
I think it would help health across the nation. So I think it's a good thing.
The suggestion from the President of America's health insurance plans is one of the first concrete steps forward in overhauling the nation's healthcare system.
I think it's good they're willing to budge, and that's the one thing. I mean, they should make it affordable if they're going to make it a requirement.
I mean, I wish them luck. I hope they can do it because everybody needs health insurance. It's very important because it's very expensive if you become ill. But I just don't see how everybody's going to have it, and the government's going to require it unless they pay for it.
I would hope that it would just cause everybody to pay the same thing. So it would balance things out where rates would be the same and you could go anywhere and be charged the same price.
The only thing I would say is the only time when people should be charged more is if their condition is due to their behavior. If it's something they can control, like if you choose to smoke, then you should pay more.
Insurers want the federal government to help those who cannot afford private insurance with subsidies or tax breaks. In return, however, they want a system where all residents are required to get insurance, similar to the system that now exists in Massachusetts.
That way you get to spread the cost across everyone and not people who have conditions through no fault of theirs can at least get a chance to get some health insurance, I think.
Depends on some of the budget packages that are currently in effect or currently going into the works right now, and hopefully they can lower. I mean, really, pressure needs to be, asserted onto the healthcare companies to lower premiums. So it's kind of getting out of control right now.
Drivers are required to have auto insurance if they're going to drive. Do you think Americans should be required to have health insurance?
I think it should be the same.
I don't think so. The reason I don't think so is because, unlike auto insurance, if you choose to jeopardize your health, that's entirely up to you. So if you decide you don't want health insurance, fine.
With WMAL Street Talk, I'm Jen Richer, 630 WMAL.com.